with large breasts and are suffering issues like neck pain and back pain, you might be considering a breast reduction surgery. But you might also be thinking whether this is worth it. Will it really make a big difference? Will it really make a benefit? Is it worth undergoing a surgery? I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Skin, ENT and Plastic Surgery, Bangalore. And today, we'll talk a little bit about why breast reduction surgery can be worth it and can make a huge positive impact in your life. Now, instead of just me talking about it, why don't we listen to our patient first? This is our patient 6 days after her breast reduction surgery. She's doing well. She has had no complications. The surgery itself was done under general anesthesia as a daycare procedure. We are seeing her on her 6th day where everything is fine. There are no stitches that need to be removed. And let us hear from her.
This is our breast reduction patient 6 days after her surgery. So you can see already it's healing quite nicely. Scars are doing well. We have removed almost 600 grams per side. So it's almost 1.2 kilos that she has to carry less every day. How are you feeling?
I'm feeling a lot better, thank you. Even the surgery wise, I feel already so much better with the neck pain, back pain, everything considering. Yeah, it's nice. It's actually good to be, like this.
Very good. And why did you decide to undergo this?
Yeah, because I used to get a lot of back pain, neck pain. I mean, especially during periods, I feel like I'm carrying like 100 kgs weight on either side. So, it's high time that I thought I should get it done.
And was the surgery very uncomfortable, very painful?
No, sir. No, you've done an amazing job. I would like to add that. I mean, it was very smooth. The process was very smooth, and people were, the staff were very encouraging, supportive, clearing all my doubts anytime. So that's good to know. That's actually nice.
Thank you very much. Very nice.
Thank you.
Thank you.
So as you can see, our patient is very, very happy after her surgery. You can just hear it in her voice. Why is this the case? I have often found that breast reduction patients are among the happiest patients of any procedure that I do. And to understand why, we need to first understand what are the issues that women with large breasts suffer from. Now, firstly, and the biggest issue maybe, is the physical discomfort. Very large breasts cause a strain on the neck and on the back. They have to bend down. There can be pain in the neck, pain in the shoulder, pain in the back, and all these are issues which can be sorted out with a breast reduction procedure. Secondly, apart from pain, there is also other discomfort. Large breasted women often aren't able to find clothes that fit them well. They aren't able to find brasiers that fit them properly. And so these are all issues that can be improved. And finally, and perhaps the one that I'm least qualified to talk about, is social embarrassment. A lot of these patients tell me that they would often be conscious moving about in society. They would get a lot of unwanted attention, a lot of unwanted stares. And as a man, this is not something that I can really understand. But all of them tell me that after undergoing this surgery, this is something that has improved a lot, and they are able to move about in society much more freely. They are much less conscious about themselves, and they have so much more confidence. Now, what are the benefits of a breast reduction? So in a breast reduction, what are we looking to do? We're looking at 1, making the breast smaller, 2, making the breast a better shape. What do I mean by better shape? A lot of people with very large breasts, the breasts are very saggy. So what this means is that the nipples are at a very low position. So during the surgery, we're looking at bringing the nipple up to a nicer position, making the breast smaller and perkier. So along with reduction in size, a breast reduction surgery also gives you a better shape, and it makes a more aesthetic, a more nice appearing breast. So if you talk, everything seems to be good, everything seems to be nice. What is the trade-off? The trade-off for this is that there will be a small scar after the surgery. So because we have to bring the nipple up and improve the shape, that means we have to remove breast tissue and remove extra skin below the nipple. So what this means is you will have what is known as a lollipop scar. In this, you have a circle, a scar around the nipple, which is not seen much because this is a natural junction between dark skin and light skin, so it's not seen much. And you have a vertical scar below the nipple. This extends from the nipple to the fold below the breast. This is the scar that is visible. Now, this scar reduces over time. It fades and fades and it becomes much less noticeable. But some small mark will remain. It will never go away completely. Now that we've spoken about the scar after breast reduction, the obvious question is it worth it? Is it worth getting this scar to undergo this surgery? And here, without exception, all my patients tell me that they don't even care about the scar. The reduction in size, the reduction in the symptoms of their neck pain, back pain, and more importantly, the improvement in shape all make the scar worth it. It's a question of shape over scar. You have a much nicer shaped breast, much nicer looking breast with a faint mark. And that is not an issue for all the women that I have done this surgery on. Now, what are the possible complications after this surgery? One is any surgery anywhere in the body, infection is a risk. Its chance is extremely low. But it is something like when you're crossing the road, you might be hit by a car, something like that. Secondly, there can be a little bit of blood collection in the breast after surgery, which might have to be drained. In order to avoid this, a surgeon might put something known as a drain, which is a small tube inside the breast to allow the breast to come out, to allow the blood to come out. And the common question that people ask is, will they be able to breastfeed after getting a breast reduction done? Now, this is a little bit of a tricky question. What I mean by this is that a lot of heavy breasted women naturally are not able to breastfeed properly. This is a complication of their breast being so large. So if you're not breastfed and you undergo the surgery, you might not be able to breastfeed, but that is more because of your breast being large in the first place. So that's why I say that this is a tricky question. Yes, you might not be able to breastfeed, but that is more likely your natural state rather than the result of the surgery itself. So it's important to understand this. So let us have a look at our patient results again with her before and afters. As you can see here in the front view, you can make out how much the breast has reduced in size. You can make out that the nipple is in a much nicer position and the whole breast looks much more aesthetic and much more perky. The small scar that is below the nipple is hardly visible. Even from the side view, you can make out just how much the nipple has risen. It's a vast improvement. It's risen almost 10 centimeters. And this cannot be done without this mark. Most importantly, in this patient, we have removed almost 600 grams per side. That's almost 1.2 kilos. Think about it. You have to carry 1.2 kilos less every single day the rest of your life. And that is why these patients are so happy after the surgery. One final question that I get from breast reduction patients is, how small can you make them? Can you make them this size or that size? Well, this is again a little bit tricky because bra sizes vary greatly from manufacturer to manufacturer. What is D cup with one manufacturer can be C cup with another. So that's why it's a little difficult to give an exact cup size. But you can give an estimate of how much weight of breast that you're going to reduce. Now, the important thing here is that you cannot make it too small, nor should you. Our aim isn't to make the breast completely flat. Our aim is to make a nicer looking breast. It's important to leave behind some breast tissue, one, so that it looks good, and second, to avoid complications. This is why the surgery has to be done safely by someone who knows what they are doing and who is experienced in breast reduction surgery. So do your homework carefully before you choose your surgeon. So that was our video on whether breast reduction surgery is worth it. I hope you enjoyed this video. If you want to get in touch with us, do contact us. Our information is in the description below and will be coming up on the screen shortly. Do let us know any other videos that you would like us to make in the comments and we will try to address them. Don't forget to like and subscribe to our channel. Thank you. Have a great day.